This is the clavicle. Clavicle is pretty simple. You've got two ends to it. You got a sternal end that's this flat end here, connects to the sternum, and then you have the acromonial end that's more rounded over here, connects to the acromonial process of the scapula. Okay, so now we're looking at the scapula. Okay, and we can see with the scapula, the first few things that really poke out at you, literally and figuratively, is the spine here. Okay, so this pokes out dorsally on the body, so towards the back there. You can see it has two processes that sit here on the top, the acromonial process and the coracoid process. And then you have the glenoid cavity, which is where the head of the humerus is going to articulate with the scapula here. You have an inferior angle towards the bottom. So if the head of my humerus articulates here in the glenoid cavity, that makes this my lateral side of the scapula. So this is my lateral border and my medial border. The fossas on these are associated with the spine. So we have the infraspinatus, below spine, and the supraspinatus fossa. On the back side, flip it over here, we have the subscapularis fossa. You also have this notch right here. Okay, this is called the suprascapular notch. Okay, so now we're looking at the humerus, your upper arm bone there. Okay, so starting at the top of it, we have the head of the humerus right here. This is what's articulating with the glenoid cavity of the scapula. Okay, then we have a neck. In the humerus's cases, we technically have two necks. So the neck is kind of where it begins to thin out from the head itself, but with the way that the humerus is shaped, we have an anatomical neck right at the base of the head here, but we also have a surgical neck right here. Okay, we've got the greater and lesser tubercles. So the greater is kind of higher up on top here. The lesser is kind of a little further down, both sticking out projections there. The intertubercular sulcus, or groove, is in between them. You can see the deltoid tuberosity, kind of this roughened part of the humerus. Going down towards the bottom here, so this will kind of be where your elbow would be. We have a medial epicondyle. Okay, so this is the large projection off to the side. It's your funny bone. It's that part you hit and it hurts like crazy. Not so funny. Okay, and then this, of course, on this side over here would make this our lateral epicondyle. Okay, you can see this kind of hole right here. Okay, this is the coronoid fossa. Then you have two projections here and here. On the medial side is the trochlea. On the lateral side is the capitulum. On the back side, another hole here, is the olecranon fossa. Okay, so we're looking at the ulna here. So you can always tell the ulna because the ulna has a U. Okay. On the top part here, you have the olecranon process. So this first projection. Well, the other projection is the coronoid process. You have the trochlear notch in between. Here, right on the side, you can kind of see this indention part right here. That's the radial notch, where the radius head would sit here on the ulna. The other end, so actually in this case, the bottom is the head of the ulna. Okay. And then it has this little projection sticking off the side down here. It's called the styloid process. Okay, so this is our radius and the forearm there. You've got the head of the radius, so it's kind of rounded. Okay, got the radial tuberosity, the projection here on the side. Okay, the radial shaft, So now towards the bottom here, we've got the styloid process, which is this larger projection sticking out the back. The other side of it is our ulnar notch. So it's kind of this notched right here, smoothened typically. Okay, so this is a hand. We can see the wrist bones here, so there's multiples of those. Collectively, we'll call those the carpals. The long bones here. In the middle are your metacarpals. And then each of the finger bones are collectively called phalanges, but we have medial phalange, distal phalange, and proximal phalange. With the exception of the thumb, which doesn't have a medial phalange, it only has a distal and a proximal.